Hello everybody, my name is Glandorf and I'm an ophthalmologist in Rheine in Germany and specialized in cataract and refractive surgery. I think there's so much information out there on the digitalization of operating rooms that it can be overwhelming. And I'm here to help you sort through this mass of material and talk about my own experiences with the digital operating room, including the problems it solves, how to implement it, and what it's brought to my practice. The biggest problem with the traditional workflow is that it's so time-consuming. You need much more time for the preoperative assessments and for the surgical planning. And if you are performing cataract surgeries in a high volume, especially with special lenses, you just reach your limits in terms of staff and time. For the intraoperative visualization, without digitalization, you have to mark the axis on the patient's cornea before the surgery starts. For that, the patient has to sit upright in an upright position, and it should also take place before any sedatives are given to the patient. So that is definitely an interruption in your workflow. And what are you doing if you're planning any special incisions like opposite clear cornea incision and so on? You cannot mark every axis on the cornea. That would be too confusing during the surgery. The setup of my digital operating room looks like it starts with the preoperative assessments. The patient is going through the clinic and we are doing all of these different devices and all the examinations are collected into Forum Viewer. We are working with Zeiss, so it's the Zeiss Forum Viewer. And a part of the software is the EQ Workplace, and we use the EQ Workplace for the IOL calculation. And the data from the EQ Workplace are imported into the computer-based marker system from Zeiss, which is called Callisto. And the Callisto is guiding the surgeon during the surgery, where to implant the axis and where to perform the incisions. During surgery, we are doing recordings, and the recordings are uploaded to the surgery optimizer. So at the end of the surgery day, I can watch my recordings. The efficiency is much greater. There are studies which show that the digitalization workflow is 2 times faster. The most time-consuming part are the preoperative assessments. Here you have time saving of 35%. For the IOL calculation, you are 30% faster, and for the data export, 100% quicker. And during surgery, you have a time saving of 3 minutes. Yeah, the chair time, that's very important today. For the most patients, it's important not to stay a lot of time in your clinic, to have a very short waiting room. And that's much more shorter with the digital operating room because it's more efficient and the workflow is just faster. The surgical precision is greater because you have the computer-based axis marking, and for me in the clinic, the Callisto can show me where I should perform the incision. And also studies show that the IOL misalignment is significantly lower if you're working with the computer-based system. I really like the digitalization form of the patient-informed consent. So first, I don't have to print out the informed consent because every day you have any problem with a printer. Sometimes they just stop to work. The second point is that with a few clicks, I can adapt the informed consent to the planned lens and its possible side effect. And the third point is that I have access to quality videos or other images to explain the surgery and the different IOL options. And at the end of the day, I have the possibility to watch my recordings. And I can remember very well a day in which I had, at the end of a surgery, a posterior capsule rupture. And I had really no idea how it happened. But afterwards, I could watch the recording and got angry about it and about myself, and that's important that you don't repeat your complications. The highest benefit is that they don't have to run to every device and print out the examination, so they can do other things better in their time. And we always have problems with the printers, and they don't have to scan and file the document because afterwards you have the problem that you don't find the exact document because the file was not correct, and that's problems we don't have anymore. The future of a digital operating room is just that become standard. I can see an AI which is supporting you in the IOL calculation, maybe an AI who is analyzing the different examination from the patient, but also analyzing the performance of the surgeons and maybe the residual refractive errors. So the AI is maybe doing kind of nomogram for every surgeon and is then planning with the examinations from the patient and the nomogram the perfect IOL power. Of course, if the AI is doing a mistake, at the end the surgeon has to be responsible for it. That's the problem. I don't see really any new emerging tech finding its way, but rather a better and improved interconnectivity, not only between the devices, but also with your clinic software and maybe also with an AI. So maybe an AI who is not only analyzing the results, but also analyzing the process in your clinic and maybe reports any mistakes, maybe if any device has been forgotten or maybe a patient file has been made double or incorrect. I would advise my colleagues to visit a clinic in which DOR has already been implemented and just to compare the workflow in that clinic with the workflow in their own clinic. I'm very confident that the effort for implementing a DOR will pay off in the long run. You can do great work without digitalization if you're implanting standard lenses, but if you are implanting special lenses, which means with toric correction on a high volume, you will just reach your limits. And the question is, what is the future of your clinic?